We often receive patients who believe that proper preparation could have prevented their gynecological issues. So here are the early solutions to a dozen of gynecological problems after 40. Grab a pencil, paper and a warm cup of tea and settle in for a long lesson filled with useful practical tips. Specific preparations are needed to maintain a body. As the saying goes, life begins at 40. Many things change at this age. You become more energetic. You learn to clearly identify life's priorities, gaining a sense of what truly matters. In the busy office and in the chaos of family life, your fame grows. Out of nowhere, old friends come from school and distant relatives start to show up. Along with those changes, several changes have to be made in a gynecological approach of your life. First, ovarian cyst. At this stage, it is of utmost importance to investigate the composition of ovarian cyst. Note that the transvaginal ultrasound or TVS gives more data about the cyst. Abdominal ultrasound does not provide as much information. If you are unsure, it is best to revisit the doctor and if needed, undergo an MRI or CT scan to make an informed decision on how to treat the cyst. Not all cysts require surgery. Who needs an operation or not depends on some international rules. These rules protect the interest of the patients. Bleeding problem. Bleeding problems after 40 are seen from different angle. The treatment is different. Before 40, the symptom control is more important in bleeding problems, but after 40, the strategy is reversed. Finding the cause of the abnormal bleeding takes priority over the symptom control. Therefore, even if the ultrasound scan report shows no abnormality, it is important to investigate further if the bleeding is irregular or causing anemia. This is by examining uterine lining with a camera known as hysteroscopy. Hysteroscopy is a daycare procedure. It means you can come in the morning and go home in the afternoon. But many women avoid hysteroscopies in the fear that insurance won't pay and they will make inconvenience to their family. So they try to suppress symptoms by taking medications day after day. That is a wrong strategy. The significance of hysteroscopy cannot be understated as it guides the choice of treatment. However, many insurance companies in India consider hysteroscopy as an investigation and do not pay for the patient. In the end, it is of course up to you to take care of your body, regardless of whether or not you have insurance coverage. So take the right steps. After the age of 40, the chances of polyp, hyperplasia or other problems of the uterine inner lining or endometrium increases. All these problems are easy to treat if caught early. Hysterectomy. Typically, if abnormal bleeding leads to a hysterectomy after the age of 40, the uterine lining is examined under a microscope beforehand. Opting for a direct hysterectomy may cause an inadequate surgical procedure. Several women need a second operation. If it is not possible to examine the inner lining of the uterus before the hysterectomy, talk to your doctor openly. You may need to take extra steps during hysterectomy. Weight control after 40. As we age past 40, our body's energy consumption decreases sharply. This means the rate of metabolism slows down a lot. Weight gain is faster. In this moment, when you tend to have more tasks and responsibilities, you don't have time for anything. You overlook your own health. If you haven't started earlier, now is the time to establish a regular exercise schedule. Except on the specific occasion, eat only small portion. We have many videos on this. I will give you the links below. If you still consume sugar, limit your intake of cakes and sweets to only your birthday. Below is a link to an article on how dangerous sugar is to human health. Don't be discouraged if the first few days of exercise don't lead to weight loss. Losing weight can be a very gradual process that may take up to 2 years to see any noticeable results. Prevention of cervical cancer after 40. Every hour, 8 women die from cervical cancer in India alone. It is interesting to note that the ways to prevent cervical cancer have been known for several decades now. Because of lack of public awareness, people do not get pap smears done when they are fit and healthy. This is a cancer which should not be diagnosed waiting after a symptom. This description box contains information about pap smear. Give it a look. A pap smear is nothing more collecting a few floating cells from the cervix with a soft brush and examining them under microscope before your problem starts. Pap smear is not expensive. It takes a few seconds to do. You can join back office in the same day. In England and in America, letters are sent to every 3 to 5 years to remind women of their importance of getting a pap smear for cervical cancer. There is no such system in our country of 120 crores. It is necessary for you to take action yourself. A vaccine for HPV now prevents cervical cancer. Many people still get their HPV vaccine even after 40. Feel free. The international guidelines say that you still require regular pap smears even with HPV vaccine. Remember that. Next, mammography after 40. As bad as it sounds, 1 in 8 women will develop breast cancer. You must not fear though. The treatments are very effective, but you need to diagnose it early. How to be careful? Breast self-examination once a month and mammography once a year. Self-breast examination should be a lifelong practice for all women starting at age 12. Self-exam of your breasts should be done monthly along with underarms. Most likely, you will forget it unless you put an alarm on your mobile. Busy women jokingly call it a payday examination. On the day they get a salary, they protect their future by doing breast examination. A link to the breast self-examination will be in the description box. Do mammography once a year. X-ray mammography costs less and it is fast. It may be slightly uncomfortable because it presses breast from both sides, but it is only temporary. If you do not want to do X-ray mammography, then fear not. You can still have scope to have ultrasound mammography. Completely pain-free, but it costs slightly more. Since it is a screening test, it does not require doctor's prescription. In mammography, the breast and armpits are checked on both sides. Fix a day for all the women in the household and return home after having mammography and ice cream together. Make it a yearly picnic. Stomach problems after 40. Who does not have stomach problems? If you experience abdominal swelling over 2 weeks, a loss of appetite, and occasional pain and pressure in the abdomen when bending forward or experiencing gas, it is recommended to undergo a complete ultrasound of the abdomen. Please do not just dismiss it as a normal gas. Some of the gynecological complex ovarian problems manifest with these non-gynecological symptoms. Many people ignore them as just gas. That is not good. Fear of menopause. Menopause is inevitable, but it does not have to be unpleasant. Your periods usually stops around the same time as your mother or aunts. This is called menopause. Many people are afraid that menopause will cause problems and ruin their sexual life or bone health. Do not listen to rumors. In order to live better after menopause, you need to know more about it. Modern women spend almost half of their productive life after menopause. Link to our masterclass on menopause is in the description box below. I hope that after watching these videos, scientific facts will enrich your mind. HRT after menopause. Hormone replacement therapy peaked in the popularity between 1990s and early this century. As estrogen hormone declines in menopause, women took estrogen left and right. Nowadays, women are hesitant to take them because of their advantages and disadvantages. It is completely up to you to decide whether to take it or not. But keep it in mind that estrogen-only HRT increases the risk of uterine, breast and ovarian cancer in women who still have their uterus in their body, that means who did not have hysterectomy. Educate yourself about this. Next, bone care. If you do not do enough exercise, take calcium-rich food and take regular sun exposure, bone density in the body decreases drastically from the age of 40. There are some specific recommendations to avoid this problem. We discussed them together in our Keeping Your Bones Healthy video. You can check it from there. But it is very necessary to be very attentive to this bone health matter. Next, the mind. As I have mentioned, women are highly occupied with their social, family and professional commitments around the age of 40. No time to look after herself. At this time, early signs of complex mental and family problems come under the guise of minor mental problems. Trivial symptoms sometimes hide serious depression. Various types of stresses will be around. Worries about the future of the children and the difficulties in the husband's job start from this age. Many lose hope in the life as they struggle with financial uncertainty and inflation. At the beginning of life, many start exercising. Around this age, they give up. Slowing down gives rise to gynecological, heart problems and fatty liver. Get help immediately if you have any such mental problems. Get counseling or show it to a therapist or mental doctor. There is nothing to fear. Next, health insurance after 40. Give yourself the gift of health insurance on your 40th birthday if you do not have it already. Nowadays, good quality treatment is difficult to afford without good quality insurance. Good insurance can be very costly. Even if your office had insurance, find out whether the insurance will continue to cover beyond your retirement. It is highly recommended to get an individual health insurance, as many insurance companies may refuse to start coverage after retirement at a reasonable premium. Expenditure in health really starts after 60 years of age. Do enough research when buying insurance. Do not just rely on the insurance agents. Go to the nearby hospitals and ask directly which company can settle an open insurance claim instead of pushing it inside the package. The premium of such open insurance policies are quite high, but it pays off at the time when you need it most. In a package treatment, you cannot choose the doctor, the latest treatment, and the medicine of your choice. So invest in the right insurance at the right time. But yes, the biggest investment seems to be regular exercise, right diet, and paying attention to mental health. So spend time with yourself. That's all today. See you soon.